The number of flu cases is surging across the country. The latest figures from the CDC show the virus is widespread in 43 states. Parts of the South, Midwest, and East Coast have been hit especially hard. And there are 14,000 new cases a week. At least 20 children have reportedly died from the virus since late 2016. Our Dr. Tara Narula is with us. Good morning.
Good morning, Nora.
So what do we know about this uptick in cases?
So even though we're seeing an increase in deaths and hospitalizations, according to the CDC, this is looking like it's going to be a relatively average flu season. Now, a lot of this depends on the strain, the viral strain that's predominant. This season, it's H3N2, which tends to be more severe, particularly for the extremes of ages, the elderly and children. As you mentioned, 20 children have died so far, which is more than at the same time last year, but we won't really know the total numbers until the end of flu season. In the prior 2 years, the rate of children died number anywhere between 80 and 150.
Wow. What do we know about the effectiveness of this year's vaccine? Because typically it's like about 40 to 60% effective?
Typically about 40 to 60%, exactly. But we think that it's a pretty good match, meaning that the viruses that are in the vaccine are the same as the circulating viruses. And the problem is really compliance. You know, less than half of Americans get vaccinated, and that's really the best way to prevent getting the flu virus.
So the people that haven't gotten it, you said less than half of the Americans. Is it too late for them?
No, it's not, and that's a really important point. So you can still get the vaccine now. Flu season runs anywhere between October and March, sometimes as late as May. Better to get the vaccine sooner rather than later, because it takes about 2 weeks for your body to build up antibodies and have a strong immune reaction. Now, it's recommended for anyone older than 6 months, and it's really helpful for those that are the most vulnerable. Again, children, the elderly, pregnant women, those with chronic health conditions.
And quickly, how do we prevent the spread of the flu?
Well, good hand hygiene. Wash your hands, don't cough and sneeze on other people. It's spread by droplets primarily, which can travel 6 feet. Wash surfaces, because it can remain on surfaces. There's no antibiotics we can use, but there are antiretroviral medications like Tamiflu, which can be prescribed by your doctor if you do develop the flu.
All right, the battle begins.
Yes.
Dr. Tara Narula, thanks.
Good advice.